It made a statement, and it went viral. Can you believe it? It was so popular. In other words, we cut out the insurance companies. They're making a fortune. And, you know, they're good people. They're business people. I don't blame them. But we cut them out. We pay the money directly to the people.
How about that? Joining us now, pleased to bring in the administrator for the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz, who was there alongside President Trump. Welcome into Newsline. It's good to see you, Dr. Oz.
Thank you, Bianca. The president was on fire today. I know you just showed that clip, but he spoke extensively at the event, which was designed to talk about the Rural Health Transformation Fund, the largest investment ever in rural health care in America. And it came out of the Working Families Tax Cut legislation, which was a massive effort to right-size the health care system. That legislation had the same president, the same Congress, the same basic situation as we're facing now with the great health care plan that the president put out yesterday. Our hope is the same team that won last time can return as reigning world champions and do it again. As you point out, we've got to cut back and slash the cost of medications. We can do that by using some of the most favored nation negotiations that have successfully dropped prices for U.S. pharmaceutical manufacturers, so Americans no longer pay 3 times more than their European counterparts for the same drugs. You mentioned insurance. The president says, and I think he's right about this, let's make insurance more efficient. Let's make it great again. Let's reduce the actual cost of the premiums. Don't just throw money at it. When you throw money at a problem, people charge you more, which is what insurance companies were able to do. So instead, for all Americans, not just folks in the Affordable Care Act, for all Americans, let's drive costs down. Dropping drug costs does that. Right. Dropping insurance premiums does that. We can use maneuvers like the cost-sharing reduction, which is part of this request, to naturally reduce premiums by over 10%.
It's incredible. And looking at some of this, reducing it by 10%, saving taxpayers $36 billion. Now, Dr. Oz, you are no stranger to health care. And the health care before some of these changes have been in, many say it has been broken and for a long time. How much of this lies in the hands of Democrats? President Trump has said they are bought off by those insurance companies. You just heard him right there saying, you know, these are business people, but not just pharmaceuticals, but now with insurance and people having the ability to be their own health advocates. It's going to tick off some people who have been making a lot of money. And are the Democrats included in that group?
Well, the reality is just transparency alone will drop costs because you allow the marketplace to work, right? If you know what it costs you to go get an x-ray in one place versus another, or your company does, they'll make choices accordingly. So what the president is asking America to do is think differently about health care. And you ask an important question. I don't think all Democrats are going to vote for this, but we don't need all Democrats, right? We need 7 in the House, and I'd rather in the Senate. And, you know, in the House, we actually have the votes. Ideally, we'd be able to just get together on legislation that we know is broadly popular. Americans love most favored nation negotiations with drug companies. It's their most popular loved item in health care. They like it when we talk about getting insurance companies not take all the money and be transparent about what they're doing. How often do they refuse your claims? Or, you know, how long do you have to wait to get a doctor? What does it actually cost you to get your care? All of this is stuff that in a common sense world we'd all do. We just need to get the Congress to act on this like they did on the Working Families Tax Cut legislation.
You know, I was listening to you, and some of the comments you made really hit home, I think, in a way that when we talked about Butler, I mean, you brought it up and talked about what the healthcare system there would have provided our president if things have gone a different way. You know, these are times we're living in. We look at President Trump. We look at your the administration that you're a part of, sort of revolutionizing what we think of as healthcare. I guess boiling down real quick, Dr. Oz, who's going to be eligible? How much money will get sent to people in these insurance payments? Because I think a lot of people with the messaging, and you know the critics are going to say, oh, people are going to drop insurance, and this is going to make the skyrocketing cost for others who stay. About real Americans, just break it down for us what this means for them and their pocketbooks as we head into the midterms as well.
But one of the legislations that was already put forward by Senator Crapo and others argued in favor of $1,000 for folks or $1,500, depending what their income level was. And the hope would be we'd rebate a percentage of what it costs to insure you back to you. We also have the MAHA element. Take that money and invest it in things that make you healthier. a stitch in time saves nine, right? Get people to make wise decisions about food, exercise, give them